Okay, we want to welcome uh, everyone to our second presentation in our All About Alzheimer's monthly series, where we hope to bring you useful information that you can take back with you to your respite and support groups and or those you might be caring for in your community or in your social support system. It's a pleasure to be here with you today. For those of you I haven't met, my name is Joan Asseff, and I'm a licensed clinical social worker here in the state of Texas. I've spent most of my career working with older adults in a wide array of settings, including skilled nursing, hospice, home health, psychiatric care, and private clinical practice. I now teach clinical social work at the Steve Hicks School of Social Work at UT Austin. I have worked extensively and intensively with patients and families going through the extreme challenges of Alzheimer's disease and other dementias. And I want to recognize the selfless and painstaking work you do in various ways to support those impacted by this very difficult disease. It's great to be here with you today as we problem solve together and support those with Alzheimer's, their caregivers and their families. Though we are recording this session, I invite your participation and questions. Please feel free to place thoughts or questions in the chat, and we will make time for discussion at the end. So with that, we'll go ahead and get started. As usual, we want to just have a quick note about Alzheimer's Texas before we get started. As I'm sure many of you know, Alzheimer's Texas is an independent local nonprofit that used to be known as the Alzheimer's Association Capital of Texas chapter. They have been a privately funded voluntary health organization since 1982, serving Central Texans with Alzheimer's disease and their caregivers. About 3 or 4 years ago, Alzheimer's Texas broke away to form their own nonprofit and decided to focus 100% of their funds and efforts here in Central Texas. Alzheimer's Texas maintains the same level of commitment, providing support, education, and advocacy for those affected by Alzheimer's in our community. Currently, Alzheimer's Texas reaches about 12 to 16 counties, though the pandemic has allowed them to reach a broader population in Texas through a virtual platform. And Alzheimer's Texas continues to carry out its vital mission to eliminate Alzheimer's disease and related disorders through the advancement of research and to enhance care and support for individuals, their families, and caregivers. And we welcome you to always reach out to learn more about the services provided by Alzheimer's Texas. All right, well, again, as any good academic, I'd like to go over the learning objectives for today. We want to identify and address the signs of caregiver burnout exacerbated by chronic pandemic-related stress. We want to better understand the impact of the current pandemic on people living with dementia and their caregivers. We want to learn practical tools for coping and living with chronic pandemic-related stress. And we want to think about and share ways we are supporting ourselves or others who are caring for people with dementia during the pandemic. As we begin to understand the impact of chronic stress associated with COVID-19 on those caring for people with dementia, it's important for us to review the major causes of caregiver burnout. This is a brief list of the major causes we usually see for caregiver burnout, and we know these are being exacerbated by the stressors put on dementia caregivers during the pandemic. For example, some caregivers might have the unrealistic expectation that they can keep their loved one completely safe from all COVID-19 risk factors if they stay totally isolated in their home. But we know that this type of unending isolation can be mentally, emotionally, and physically unhealthy for both the caregiver and the person living with dementia. Also, COVID-19 makes it harder for both caregivers and people with dementia to feel safe going to their primary care doctor, the gym, or their faith-based community. Increasing the risk for neglect of these key areas of self-care and functioning. Of course, the pandemic has also increased caregivers' experiences of unreasonable or conflicting demands. And many of you, I'm sure, have seen this or have experienced this. For example, There may be an unreasonable and conflicting demand of keeping their loved ones safe, but also needing to take them to doctor's appointments, such as the neurologist, the psychiatrist, or heart doctor. We know that many people living with dementia have comorbidities that require frequent doctor's visits. And the pandemic makes these conflicting demands even more challenging for caregivers. As the pandemic drags on and ebbs and flows in severity, we know that dementia caregivers are faced with many additional stressors that put them and their loved ones at risk for caregiver burnout and other negative outcomes. We know that caregivers have experienced the suspension or reduction of adult daycare and respite programs, like the ones that some of you direct, because it simply was not safe to operate them. The minute we thought it might be safe again this summer, COVID-19 rates surged again, leaving caregivers without much needed respite support. We also know that caregivers are receiving reduced peer support, socialization, and recreation options. When you are caring for someone with dementia, it's much harder to pack up your loved one, go to the park, and visit a friend outdoors where it might be safer. Friends might be worried about passing COVID-19 to the vulnerable person with dementia and their caregivers, so they don't reach out about getting together or to check in. While there are virtual and telephonic options for caregivers, we know that some people are experiencing burnout with being on screens, and that might be some of you here today. And some people simply don't enjoy this mode of communication. During the pandemic, there have been delays and reduction in the accessibility of basic needs support as well, such as meal deliveries to homes, the accessibility of food pantries, and other vital services. Exacerbating this reality is the fact that many people lost their jobs during the pandemic, meaning the primary wage earner in some homes might have been impacted. Caregivers might be getting by with fewer resources because their partner or child can no longer provide the same level of financial support. We also know that the no visitor policies in some hospitals can be a terrifying reality for caregivers, for people with dementia who often have to go to the emergency room, possibly after a fall or for altered mental status. This reality and the fear of infection has also led to some caregivers delaying access to healthcare for both themselves and their loved ones. We also cannot underestimate the stress caregivers are experiencing because they must keep an even closer eye on their loved ones' movements and behaviors due to the risk of infection. Before the pandemic, their loved one might have approached someone in the park and said hello with no concerns or problem. Now approaching someone could be potentially life-threatening if that other person is not vaccinated. Finally, caregivers are coping with new methods for case management, mental health provision, and support group services. Many of these services are now provided virtually or by phone, which can increase accessibility for many people, but also increases a sense of isolation for some people. For example, some hospice social workers greatly reduced the number of in-home visits they provided during the pandemic, opting to provide resources and support via phone. This change reduced the level of support received by both the patient and the caregiver, but was a necessary change to reduce the number of care professionals going into the home. All of these stressors add up over time to produce a higher risk for caregiver burnout. Finally, we know that the chronic isolation and fear associated with the pandemic can heighten a caregiver's experience of what we call anticipatory and disenfranchised grief. For those of you who might be less familiar with these terms, anticipatory grief is the feeling of loss many dementia caregivers experience before the death of their loved ones. Long before their loved one dies, they might lose their loved one's recognition of them as a family member, or the emotional support their loved one provided when they had their full cognitive abilities. In the pandemic, caregivers could experience this type of grief even more intensely due to their inability to host family events with their loved ones, or to celebrate fully with their loved one who is declining in health, for example. Caregivers are also experiencing disenfranchised grief, exacerbated by COVID-19, meaning others in the community or in their family might not recognize the grief they are going through. An example might be a caregiver might experience grief over their lost time with friends because they have reduced access to respite care. But the larger society doesn't recognize or see this loss. They might experience grief over missing the birth of a grandchild because they didn't want to risk getting infected with COVID and potentially bringing the infection back home. These experiences of grief are very real and salient for caregivers, especially during the pandemic. So as you can imagine, early studies are showing a significant adverse impact of the pandemic on those caring for folks with dementia. A study conducted earlier in the pandemic in April of 2020 found these staggering statistics. 92% of Alzheimer's caregivers say their stress is higher now because of the coronavirus. 80% of these Alzheimer's caregivers reported having one or more symptoms that are typically found in individuals experiencing severe stress. You can see here the breakdown of symptoms experienced by caregivers responding to this survey, including sleep problems, vigilance, difficulty concentrating, irritability, and trouble experiencing positive feelings. 73% of those taking care of people with Alzheimer's disease at home were unsure what would happen to their loved one if they got sick with COVID-19. 42% of caregivers were unsure what to do if their loved one with Alzheimer's became sick. These figures are staggering, but not completely surprising, given all the stressors and factors previously highlighted. So in the face of all of these challenges, we must ask ourselves, what can caregivers do? Or what can we do to support caregivers, depending on our role? While caregiver access to various types of support has changed in this pandemic, there are still concrete steps caregivers and those who support them can take to mitigate these factors and foster resilience. These include assessing for caregiver burnout, developing a plan for caregiver burnout prevention, creating contingency plans for the caregiver or care recipient with a COVID-19 diagnosis, accessing mental health services, support groups, and social support networks, and then finally utilizing respite care if it's safe and possible. I will go over each one of these individual interventions and provide some practical examples and tools. So in order to properly assess whether we are experiencing caregiver burnout, it's important to review the signs of caregiver burnout. I'm sure none of these come as a surprise to those of you who care for those with dementia in various capacities. If you are a caregiver for someone with dementia, it might be helpful to occasionally take a look at this list and ask yourself, how many of these symptoms are you regularly experiencing and how often? If you are someone who provides supportive services for caregivers, you can provide this list to those you are supporting and check in with them to see if they are struggling with any of these signs. You also might be the one who could help connect them with supportive services in the community if they are experiencing some of these symptoms. So I want to touch on some formal and informal methods to assess for signs of caregiver burnout. As I mentioned before, simply reviewing the list of signs for caregiver burnout can raise a caregiver's awareness of what they might be going through. Sometimes we are so busy with caregiving, it's easy to ignore or simply not realize how bad we are feeling physically, emotionally, or spiritually. Journaling, maybe at the end of the day, can be a helpful exercise. Writing down our feelings and experiences can help us take inventory of how we are really doing. It can also help us keep track of our experiences and functioning over time. At the end of a week, a caregiver can review their journal and honestly reflect on how they are doing overall and what they might need to change to better support themselves. Talking with a trusted loved one or friend about how you are doing can also be helpful. A close friend or family member who knows you well might be able to let you know if the changes or experiences you are describing are significant because they have a good sense of your baseline, physical, mental, and emotional functioning. They'll know if the change is significant. But it's important to be sure to reach out to someone you know who is emotionally stable themselves and not going through many significant stressors as well. It can also be helpful to contact your physician or mental health provider to discuss the additional stressors of being a caregiver for a person with dementia in this pandemic. A doctor, psychologist, or clinical social worker can ask important assessment questions that could lead to helpful referrals and access to vital mental health and case management services. These professionals are more likely to be plugged into the services that are up and running during COVID. They will know, what services are open and functioning, which could reduce the caregiver's burden of looking for these services on their own. And finally, if you're a person who prefers more formal assessments, you might appreciate completing an evidence-based assessment tool for caregiver burnout or caregiver functioning. These can be completed by a caregiver themselves or by a mental health or professional or case management professional. There are several formal caregiver assessment tools out there. The Caregiver Self-Assessment Questionnaire and the revised Scale for Caregiver Self-Efficacy are just two commonly utilized scales. I have actually placed links to information on both of these scales at the end of the presentation if anyone would like to take a look at those. So it can be a really helpful exercise for caregivers, especially during the pandemic, to develop a personalized burnout prevention plan. This can be an essential protective step that caregivers and those who support them can take. These plans can vary greatly and should really represent meaningful, COVID-safe interventions for each person. The most important questions to ask when developing such a plan are, what brings me joy in this time of crisis during COVID-19? And what do I look forward to? Having something to look forward to has been shown in many studies to be a preventative factor for depressive symptoms. Unfortunately, we no longer have access to some or many of the joyful options available to us before we begin dealing with this stressor on a daily basis. However, most caregivers for people with dementia have access to various resources, including their own resilience. I won't go over every one of these, but I do want to touch on a few. So first, it's important to really develop an actual plan, whether the plan is handwritten or typed or simply saved in a note on someone's phone. Making a formal plan helps increase the number of joyful activities or protective factors identified by the caregiver and the likelihood of follow through with the plan. If the caregiver is not able to follow through with their plan, then they can use the list as a point of reference to determine what aspects of the plan might need to be changed. If personal resources allow, using a meal service delivery plan can be a game changer for many caregivers. Just as an example, when a caregiver does not have to worry about making dinner because tasty, healthy meals are already available or on their way to their home, this can lead to a significant reduction in stress. If a family does not have the resources to pay for meal service delivery, scheduled meals delivered by friends or possibly an agency like Meals on Wheels can help reduce caregiver stress. This is a time for caregivers to frequently and clearly ask for what they need. If you support caregivers in the community, you can encourage them to speak up now more than ever about what they need. Many faith communities or other groups are more than happy to start a donated weekly meal train or grocery delivery service to support caregivers during this time. The best thing we can communicate is ask for what you need. You will see that I use words like simple and favorite throughout this list of options. It's very important that caregivers identify what simple and COVID-safe experiences would reduce their stress. Diet and exercise are always important, but especially now. I recommend that all caregivers have as part of their plan a way to make sure their dietary and exercise needs are met. Socialization is also essential. Caregivers can schedule calls, virtual visits, or COVID-safe time with friends or family that is also accommodating to the person living with dementia. For example, is there a large park where everyone can meet with lawn chairs? Are there support groups or recreational groups caregivers can attend virtually or otherwise? Are there safe, enjoyable activities to do with the person living with dementia, such as walks, visiting a neighbor's dog, getting a drive-through dessert, one of my favorites, scrapbooking, or watching a movie together? What about making sure you play some of your favorite music each day? We know that music can be very therapeutic, or listening to a favorite podcast. It can be helpful to have enjoyable books or TV shows identified to provide something to look forward to. That's the really important aspect here. Also, knowing you have a scheduled meeting with a therapist, counselor, or faith community representative can also bring great comfort and help caregivers cope with the challenging times when they feel isolated or overwhelmed. And finally, it's very important for caregivers to have scheduled respite breaks as part of their burnout prevention plan, if at all possible. While respite options have significantly declined or changed in the pandemic, depending on where you are, caregivers may still be able to identify vaccinated individuals in the community who could provide routine respite care in their home if they decided that they were comfortable with the amount of risk. Unfortunately, there is always some amount of risk in this pandemic, as we have learned. I will get into more detail later in the presentation about some tools caregivers can use to help make decisions about respite care. So here is a sample burnout prevention plan with some tasks modified to fit with current safety needs related to COVID-19. It's important to note that for this specific caregiver, this hypothetical caregiver, a 4-hour block of respite care each week is a vital part of their plan. If caregivers have resources to pay for individual respite care and they have assessed their risk level and the risk level of their loved one, then now is a great time to use some of those resources if you have them. We also hope that many community respite care services can soon reopen their doors when it's safe. If you are in a supportive role with working with caregivers, then you can encourage them or help them develop a burnout prevention plan much like this one. It's important for caregivers to be as specific as possible in these plans. The more specific caregivers can be in their plan, the more impactful and supportive the plan will be. For example, if their favorite music is Whitney Houston or 80s music, then they might even write down something very specific, like listen to 80s music every day. You can see that this plan mixes up virtual socialization, in-person distance socialization with a neighbor who is vaccinated, and some activities in the house that the caregiver can enjoy with their loved one. These plans will vary from caregiver to caregiver, but they can remind caregivers about what they have to look forward to, foster a sense of accomplishment, and ensure that they are taking care of their emotional, spiritual, physical, and social needs. If developing a burnout prevention plan seems too overwhelming for someone, which would be understandable in this stressful time, simply developing a self-care plan can go a long way towards supporting mental health and well-being. A self-care plan can be tailored to each caregiver's needs and priorities. You can see one very simple sample here that helps the caregiver take note of their specific signs of burnout, which stress relievers provide short-term or long-term relief, people they can call for support when they are not feeling well emotionally, and helpful reminders or mantras they might have. For example, the caregiver might write something like, "This too shall pass," or "Looking forward to coffee with Sarah on Thursday." Anything that gives them hope and something to look forward to, or something that inspires them. Of course, there is the old saying, but it is still very relevant today. We hope for the best, but we plan for the worst. While the idea of creating a contingency plan can be daunting, it can also help give some control back to the caregiver in a time when we have all lost so much control and so many options. While having a contingency plan as a caregiver is always important, it is even more important as we face this daily health threat of COVID-19. I have outlined the basic elements here of a contingency plan for caregivers who find themselves diagnosed with COVID-19. First, it's vital to have someone identified as an alternative caregiver. While it might be a very complex task to identify this person or a caregiving agency, it's important to have them identified in advance and aware of this commitment. To make sure the alternative caregiver has all the information they need, the caregiver can create a plan of care that could be easily accessed or shared in advance with the alternative caregiver. Here are just some of the important details to include in the contingency plan of care, including the person with dementia's daily schedule, medications, information for their healthcare providers, emergency and supportive contacts, and the location of important documents, such as the medical power of attorney and living will. It's also important to make sure the alternative caregiver is listed as an authorized contact with the person's primary healthcare providers, so they can actually access healthcare information on behalf of the person. Caregivers can compile this information in an electronic or hard copy file, or they can use a formal template to capture this plan of care. The Center for Disease Control has a plan of care template caregivers can use to capture this important information, and I have included a link here to this resource in case folks want to take a look. And finally, it's important to consider what to do in the complex but very possible scenario that both the caregiver and their loved one test positive for COVID-19. Are there caregiver agencies that will agree to take care of patients with COVID-19? Is there a vaccinated family member who would be willing to take care of or arrange care for the person with dementia while they recover from the diagnosis? These are challenging questions to answer, but they are much better addressed when you're not in the middle of a stressful time or experiencing symptoms due to a COVID-19 diagnosis. All right, so during this time of chronic stress related to the pandemic, it's even more important for caregivers to strongly consider accessing formal or informal emotional support. Friends and family can be incredible forms of support, but they might also be experiencing anticipatory or disenfranchised grief and incredible stress themselves. These more structured types of emotional support can be a reliable and often unbiased source of resiliency, comfort, and coping for caregivers. These are just some examples, excuse me, of the more structured forms of support, including licensed psychologists or clinical social workers, integrated behavioral health clinics, where you can see a physician and a licensed mental health professional in the same clinic, support groups where you can talk with others who are experiencing similar stressors and share ideas about effective coping and planning. And faith-based groups or individual counseling can be an incredible source of emotional support for those who benefit from a spiritual perspective to resiliency and coping. Finally, times of chronic stress can push us toward more maladaptive or negative ways of coping, such as drug and alcohol use. For those who struggle with these challenges, now is a great time to revisit and utilize resources that support caregivers to avoid returning to negative coping strategies. Alcoholics and Narcotics Anonymous are just two examples. However, in our virtual world now, there are many groups that form around various life challenges, and they can be important sources of support for many people experiencing stress during this pandemic, especially caregivers of those with dementia. All right, so we know that respite care is one of the most effective tools for preventing caregiver burnout. However, the decision to resume respite care in the pandemic, whether provided by an individual, group, or facility, is a continuous process of assessment, planning, ongoing monitoring, and frequent reassessment. Depending on where you are located, the risk for exposure may vary and change over time. It's important to continually monitor and regularly reassess the safety of providing and receiving respite care. It's also important that all individuals involved in providing and receiving respite care have assessed their personal risk level, agree to a plan for respite care, and stay in close communication about potential changes that need to be made. Of course, CDC guidelines should always be referenced, and every person should consult with their primary care physician about their own level of personal risk. Other helpful guides on accessing respite care can also really help caregivers. For example, the ARCH National Respite Network and Resource Center has a family decision guide for caregivers considering respite care during the pandemic. I have included a link here for this organization's National Respite Guidelines and their Family Decision Guide. The Family Decision Guide asks questions such as, who is impacted by the decision? Who should be informed about the decision to return to respite care, that is? And consider other family members, friends, or providers. Are there any local or national guidelines that need to be considered? These types of tools can help caregivers make decisions about respite care, such as whether they have considered and accept the risk associated with a vaccinated family member or other friend providing respite care each week. This is a personal and health-related decision that every caregiver and family has to make for themselves, but it's important to consider all respite care options. We know that many caregivers struggle without this routine break or these routine breaks from the role of caregiving. All right, so that's the end of our presentation. I would like to open up the floor for questions, but also any sharing that you'd like to do today about strategies that you've seen in the community for preventing caregiver burnout during the pandemic. Thank you so much.